welcome to this meeting of Inverclyde Council Social Work and Social Care Scrutiny Panel. This meeting is being held remotely and also in person and will be filmed and recorded for live and subsequent broadcasts available through the Council's website. The Council is a data controller under the General Data Protection Regulations and the Data Protection Act 2018. We broadcast and record council meetings to fulfil our public task obligation to enable members of the public to observe the democratic process. Data collected during the process will be retained in accordance with council published policies available through the council's website. Members of the council are reminded that they should follow the council's established meeting protocols, including around the use of the chat facility, and that comments made in the chat facility are visible to all participants in the meeting, which may include members of the public who have also received invites to the meeting. So I'll now hand over to Diane for apologies, substitutions and declarations of interest.
We have apologies from Councillor Daisley, with Councillor Crowther substituting. We'll now move to a roll call before asking for declarations of interest. Can the following members please indicate if they're present at the meeting either in person or remotely? Councillor Armstrong.
Present in the chamber.
Councillor Brennan.
Present in the chamber.
Councillor Brooks.
In chamber.
Councillor Cassidy.
Present in the chamber.
Councillor Crowther.
Present in the chamber.
Councillor Jackson.
In the chamber.
Councillor McCluskey.
Present in the chamber.
Provost Mackenzie.
In the chamber.
Councillor Quinn.
Present remotely.
Councillor Reynolds.
Present in the chamber.
Councillor Robertson.
Present in the chamber.
Are there any declarations of interest?
Councillor Crowther as well. Councillor Cassidy.
And secure application to declare to item number 7 on the agenda are reasonable relative to the board when organisations mention the report of applied objective test and will consider having any interest in declare because it is an updated report and not subject to any officer recommendations.
Thanks, Councillor Cassidy and Councillor Crowther.
Item number 6 is the Garrett home inspection as my partner is a service user, and we also have the community alarm installed.
And you've applied the objective test. Councillor Crowther, yeah, thanks very much, thank you. Okay, so we'll now move on to item 2, which is the Revenue and Capital Budget Report, and I'm handing over to Dave Gibbon for that report. Thanks, Craig.
Well, thank you very much, Convener. This is our standard finance paper that we're going forward to the scrutiny. This covers a number of main areas. It shows current position where we are. As at period 7, we're currently projecting an overspend of £451,000 in the social care budget. There are a number of over and underspends within the overall budget. The main driver for the total overspend is due to the Children and Families budget projecting a £3.168 million overspend. This is mainly due to residential placements and child respite overspends at period 7. We're planning on use at this point using £200,000 for smoothing reserve to help this overall position. Jonathan and his team are currently doing a thorough service review in this area, and further details of this are in the paper this afternoon as well. This is partially offset by underspends in older persons, learning disabilities, physical disabilities, secondary care management and mental health vacancies. Moving on to the capital section 4, shows the current capital position, and at this point we're not showing any significant spend to date. This is likely to be incurred next year, especially with the bigger projects that we're working on, for example the Community Hub capital project. Appendix 5 shows our overall earmarked reserves. This shows we started the year with £24.262 million, and we expect to finish this year at just over £15 million based on the current projections. As always, appreciate there's a lot in the paper and happy to take any questions anyone may have.
Thanks very much, Craig. That's a really full report, and thanks for the narrative around it. So I'll open up for questions and comments. So I see I've got Councillor McCluskey at this point. Thanks, Councillor McCluskey.
Thanks, Convener. Thanks, Craig, for the paper. Just 2 brief questions. In 3.2.3 on home service, care home service, it talks about continuing to experience recruitment and retention issues. I'm just wondering if anyone can speak to the effect that the changes in terms and conditions for home care workers has had, if any, at this point, or whether we're experiencing the same sort of problems as we were before. The second is just partly an observation that maybe for a future meeting. I'm just wondering, with regards to the earmarked reserves that are on page, can't see a page number actually, but the earmarked reserves table, I think that's for something similar at the IJB, for the IJB budget. Could we maybe at some point have a paper allowing us to have a bit of a discussion about what's contained within the earmarked reserves in a little bit more detail if that's possible. I think that's already been done on the IJB side, but if you would tell, that'd be great. Thank you.
Thanks. Craig?
I'll come in just in the second part there, I'm more than happy to do. And we'll also cover that as part of the general budget setting process as well.
Okay, thanks very much. And then Alan, thanks.
Yeah, thank you. The team are still working through the recruitment and retention of the service. I'll say it's early days, and I think as for a lot of services, the time of year at the moment, there's a natural dip anyway in terms of recruitment. You'll probably notice, you can see there's advertising boards up in various locations, and as we come into this late winter, early spring, really start to push on the recruitment. And you'll see from the item 6 today, in terms of inspection, that your ability now to go and showcase very high quality service. So that is certainly a work in progress, but the team is certainly very dedicated to pushing that, and we'll have to bring further updates as the year progresses.
Thanks very much. Thank you. Councillor Robertson?
Thanks very much. So my question is about 3.2.8, which is the alcohol and drug recovery service, and just again, because there's the underspending in employee costs, I think probably there are recruitment retention issues that would be understandable that would be a context that part of that scenario should be in as well. But it still just does seem kind of something that we need to keep questioning when there's an understanding client packages. It's just showing to see if there are things that people who are in the alcohol drug recovery service need that are not being provided for them because we've got an understanding the client packages availability.
Thanks, Councillor Kate.
I'm happy to come in here. I think across the board we're finding that in terms of our providers' ability to cover it. And certainly within our new strategic plan, some of our commissioning intentions is to strengthen that and make it a bit more straightforward also for providers to provide that level of support. But it is a very challenging time across the board because then they themselves are subject to, just like the issues that we have with recruitment, so free. So we probably need to get in different conversations with our third sector partners about how do we do that differently. Working on the models that have actually worked well, which is on recovery cafes and things like that.
Thanks. Yes, you're Councillor Robertson.
So the money that comes under client packages, is that also like employee people and is that
No, it's commission services generally. We would commission support for individuals that require support. So our providers that are in our commissioning plans, that would be, so if someone has specific needs and needs a level of support just to do the living and keep them safe, we would do that in the same way for people that are subject to alcohol, complex issues around alcohol and drug misuse in the same way. It could be rehab as well. So there'd be a variety of uses of that money, but it's generally commissioned. It's not provided internally.
Thanks very much, Kate. Okay, thanks. No further questions or comments. So can I just ask that the panel notes current year revenue outturn, current projected capital position and the current reserves position? Okay, thanks. Thanks, panel. So we're on to item 3, which is our National Care Service update. So we've got some correspondence here that Jonathan's going to talk us through. Thanks, Jonathan.
Thank you, Convener. The report before panel members today provides further update on the progress of the National Care Service Bill. However, as members I'm sure are aware, since the report was written, the Health Secretary for the Scottish Government confirmed that implementation timescales have changed, and it's proposed that there will be a delay in implementation by 3 years to the 2028-29 financial year. The report itself, however, gives an update in terms of activity before stage 1 scrutiny of the bill ends at the end of January. And as the convener referred, there's an appendix to the report, which is a letter from the Minister for Social Care, Mental Wellbeing and Sport to the Health, Social Care and Sport Committee of the Scottish Parliament. The letter included a number of key messages to provide an update on progress, and some key messages in terms of social work and health provision included the proposal to move away from the creation of care boards to reform of existing integration authorities, which would be accountable to a new National Care Service Board. The letter also refers to new powers for the National Care Service Board to enable access to health and social care support for all, as well as overseeing an improvement support and escalation framework, which could also provide an opportunity for direct intervention where that was required. It's intended that ministers would be able to directly fund reformed integration authorities alongside the introduction of an independent chair at local level, and it also refers to the ability of reformed integration authorities to join across current geographical boundaries. Of particular interest within my capacity as Chief Social Work Officer, the letter also outlines an update on the developments around the creation of a National Social Work Agency, and it restates that commitment, but it does provide some limited detail at this time, particularly about the role of the Chief Social Work Officer, the place of national organisations, and the impact on professional leadership, assurance and advice to councils. Within the report as well, there is reference from 3.7 to 3.10 of the conclusion of 4 strands of research that were commissioned to inform the development of the care service, particularly around the place of children and justice services. It's important to note that no decision has been taken yet regarding whether those services would be included in the development of the new National Care Service, but key findings at 3.9 in the report highlight some relevant emerging messages from that research, particularly around the importance of relationships in practice, the need for support from other services being key, particularly around housing, health and education. And it also recognises the impact of the COVID pandemic on demand and shifting demand for particular services. The research also highlighted the enthusiasm of the national workforce around social work and social care, and recognised their ongoing commitment, just as we would see at local level in Inverclyde, but recognises the need for staff to feel supported through a time of significant change. It also notes the importance of multiple systems being a support and not a hindrance, and it also notes the critical place of leadership and the complexity of leadership roles within social work and social care that we would expect to see reflected in further work around the development of the service. In my capacity, I will continue to take part in national discussions with other Chief Social Work Officers as we clear stage 1 and move into later stages of the bill, but I hope that's of some assistance to members today. I'm very happy to take questions where I can.
Thanks so much for that, Jonathan. That's some really significant key messages in that correspondence. Thanks for talking us through them. So just opening up for questions and comments. Councillor McCluskey, Councillor Jackson. I'll take Councillor Jackson first, then Councillor McCluskey, and I'll just check the chat. Councillor Jackson, thanks.
Thanks. Jonathan, I think it's fair to say that the bill which went for the Scottish Parliament bears the resemblance to what we're looking at now. The National Care Service kind of dedicated on the creation of the care boards, and now we find out the care boards been scrapped. Care boards were to replace the IGBs, but now we're reverting back to the IGBs. And I'm led to believe that 30 pages out of that 38-page document now needs to be deleted because of that. even yesterday, the Royal College of Nursing saying it's no time to scrap. I think again, it's, you know, just throwing people in after bad. You know, the National Care Service was meant to cost 1.2 billion. It's spent an estimated 2.5 billion. Was meant to be ready to go for 25, 26, we were looking at 28, you know. I suppose anybody theoretically could recognise the, you know, kind of resemblance to what's going on locally in the shipyards. But building the place, 3 years on it, I think it's been time to just admit it's time to scrap it. Not just the Royal College of Nurses, but all the trade unions saying this is well thought out. It's just a mess. I mean, we're even still waiting now. It took me 2023 that the Scotland Government were asked about the VAT implications about the care boards. And even now, we still don't know the VAT implications stand. You know, we all know what happened with Scotland, who was created, went ahead, ignoring the advice. It's just a shambles for us. I think it's now time for the ways to accept, and even colleagues in the benches opposite, is to explain and start again.
Thanks, Councillor Jackson, thanks. I think that's it. I don't know if anybody wants to make a comment on Councillor Jackson's statements at this stage. I think we'd definitely note them here at the panel. Thanks, Councillor Jackson. Councillor McCluskey.
I just want to start with some general observations and then questions specifically about how we're going to take this forward as a council. I think the fact that there have been so many changes to this bill shows us how deeply flawed it was to begin with. As Councillor Jackson said, the bill that's in front of the Scottish Parliament now bears little resemblance to what we had before. But even with all the changes that have been made, we still have a complete lack of clarity in a lot of areas. There's still a lot of the issues that we raised in our council submission to the bill committee and to the consultation still stands, especially around ministerial powers and power grabs, and I'll come on to that in a moment. Councillor Jackson mentioned the Royal College of Nurses. I think it's actually worth reading exactly what the Royal College of Nurses said yesterday about the proposals. So they said, we previously raised concerns that the bill is being taken forward without a clear understanding of how to fix the current problems facing the sector or enough planning to ensure the effective functioning of a national care service. In our view, this remains a real risk, and we are extremely concerned that pushing ahead with the current bill will deepen the crisis within the sector. So they are not just saying it's insufficient, they're saying it can actually make the crisis that we're facing at the moment even worse than it is. I just want to turn to two specific issues, one around local accountability and the other around costs. On local accountability, again, drawing us back to the response that the council put into the consultation, that was one of the key areas that we pushed on, about the role of local government, the role of our staff, the role of us as councillors to make decisions about our services. And the bill as it stands still is nothing more than a power grab by central government. So the care boards have been abandoned, we've got the integration authorities, but they're likely to look very little like what the IGD looks like at the moment. Instead of the rotating chairs between council and health board responsibilities, what the government's now proposing is an independent chair, not accountable to any of our local electorate, but accountable to a national care board appointed by ministers. So in other words, what is at the moment a joint responsibility between health boards and between us and Greater Glasgow and Clyde in our case, we would have an independent chair appointed by the government, responsible and accountable to a board appointed also by the government. Now that doesn't sound like local and democratic accountability to me. It sounds like a complete power grab by the Scottish Government. The second point on costs, Councillor Jackson's already mentioned how some of those costs have increased. On establishing care boards alone, or the new integration authorities, we're now looking, according to the financial memorandum, at nearly £500 million in 1 year. That's just in 1 year. Not to do anything, not to fund any social services, not to fund social care, not to increase wages for social care workers, but just to establish the bureaucracy around this new system. So just turning to the questions. Firstly, the council submission was obviously very strong and robust in its response. Given that the bill as it stands, even with the changes that have been made, doesn't address some of the concerns that we raised, how can we as a council or via COSLA, but actually, us as a council, be robust in our response to the bill at this point in time before stage 2 begins, and what routes are we pursuing through COSLA to make sure that our views are heard, and finally, what confidence the officers have in terms of the discussions that have happened with COSLA so far that the government is likely to move on some of the areas where we as a council were particularly critical in our response last year. Thanks very much.
Thanks, Councillor McCluskey, thanks, Councillor Jackson. So I'll hand back over to yourself. So obviously some critique there of the info that we are getting through, and Councillor McCluskey's obviously kind of couched it in terms of 3 questions, and if there's any possible way of responding to Councillor Jackson's comments as well. So I'll hand over to Jonathan in the first instance. Thanks, Jonathan. You're obviously here as the messenger at this point. Thanks.
Thank you, Convener. Absolutely, and I suppose that's one of the challenges within some of the national discussions as part of the Chief Social Work Officer Committee about any significant change process. But really, in terms of my professional role, it is about ensuring that our workforce and our elected members are clearly advised and aware of the journey of the bill and some of the changes that were highlighted in the letter from the Minister in the report today. I suppose I'm not going to, and I don't perceive that I was asked or expected to respond to some of the points that councillors have made directly. However, I suppose from a professional point of view, in terms of the social work and social care workforce, we continue to provide our services to our local communities, and we continue to consider within developments of services and within our service planning arrangements how we could anticipate potential changes at local and national level, and we will continue to do that. And I suppose in my formal capacity as Chief Social Work Officer, as I said before, I will continue to participate in those collegiate discussions around consideration of the impact of the bill in its current form and in any further iterations from both a local and national perspective. But beyond that, I don't know if there's much else that you say, Convener. It's a letter, but I think Kate may be able to offer a further insight.
Thanks, Jonathan. Thanks, Kate.
Unfortunately, I don't have any great insights here either. I think there's lots of assumptions being made around the engagement within the sector, around the professional officers that lead the sector, about what the shape is at. That's not an unusual situation in my experience, being a social work leader for over 35 years, that we are sometimes not asked. And so all I would say to the scrutiny board today, that when you've seen different iterations of where, in the case of social work landing over the years, the impact of that restructuring has at times been at the detriment of service users. So all I can say to you as the Chief Officer is that I will continue to give assurance that we will ensure that the distractions that are out there at this moment in time will not get in the way of us delivering the services within Inverclyde, and that we need to focus much more on the inequalities now that are coming out that we're actually dealing with as a result of the pandemic and the legacy of Inverclyde, and not spend too much time being preoccupied about the great debate out there. I think at the point that we get to where 2008, and for me that seems a long way off, in a world that is really complex at this moment in time, that we will engage, we will give our views. I'm sure that the Chief Social Work Officers, and I was one, we're very clear about the benefits or the visibility of benefits about change at this moment in time, and I would still be unsure about the benefits of change at this moment in time, bearing in mind that it does impact on the delivery, even the fact that we're spending time today talking about it, as opposed to focusing on the outcomes for people within Inverclyde.
Thanks for that, Kate. Councillor Gussie,
Yeah, just a quick thought. I totally take the point, Kate, and I agree with you that the focus is obviously on delivery of services, but in terms of the role of this panel, so obviously one of the 4 things in the standing orders we've set up this panel, point D was oversight of the National Care Service, responding, like, it's a quarter of our work insofar as the standing orders go that it's on the National Care Service. So I think that's why it's important that we as a panel are able to discuss this and reports are obviously brought on a regular basis. I just want to push a little bit on process here, but I wasn't really hearing, how we are going to continue to exactly how we're going to feed back into the council process or the individual process, given that the council did take a very strong stance against the bill in the last form, and now we've got an updated form. I know that it's been discussed at council leaders and other forums, but while we don't want to be preoccupied by this, it will be the biggest change to social work that goes through. So how do we as members continue to make our views heard and then for those to be fed back into the national process?
I mean, we do feed into the COSLA, we provide briefings, and I would suggest that we would continue to do that. But I think we have to focus on the impact in Inverclyde and what it means for Inverclyde, as opposed to constantly look at the national narrative. Is quite, and I think for me, I would suggest that it needs to be about our people and what works well for our people, and that we provide that level of briefing. I mean, officers are quite restricted in what their positions can be, and we cannot take a view, but we can take a view around when it's not safe for people, and we can take a view where there is risk for people. We're not here to criticise or endorse the view of Scottish Government in the direction of travel. We're here to manage about how we manage and deliver outcomes for people within Inverclyde. And we will continue as officers to provide that level of support to elected members through the COSLA process.
Okay, thanks, Kate. Councillor Robertson.
Thanks. Yeah, I just felt a little bit when it came in. My conscience was particularly, we were saying, it is parts of this are a distraction. They do seem a distraction, but I'm just aware if we take everything back to our colleagues at Holyrood, cross-party support for there being a national care service, this is something that everybody agrees should happen on some level. And I'm just wondering if there's a way to get back to the purity of the essential things that everybody did agree on that did need to change, in terms of realising them, whilst truly still being able to say, as you guys have just said, there's local stuff that needs to keep happening, that we can't veer off of, that we have to be able to focus on and resource, but bearing in mind that there are things that everybody in that other chamber agreed needed to change on a national level. Always try and come with a solution-focused approach to things. There is a way to be utterly pragmatic and not tremendously political about it and go, we all have some stuff needed to change, let's go on and change those and let everybody go on at a local level with the things that they need to go on with. I am a simple soul, that is my simple solution. And I don't know how else to communicate that to the powers that be than through the opportunity that I've got with my light on in this chamber and this scrutiny panel.
Okay, thanks, Councillor Robertson.
I don't want to kind of project it, but I think our new strategic plan allows us to, we can only influence here and influence what is good about Inverclyde and make the improvements. And in many respects, what the outcome are what the recommendations of the Feeney report. No one would disagree with them. I wouldn't disagree with them. It's the devil is always in the detail, and we don't have the detail. So at times, we find it really difficult to comment as professional officers because we don't have the detail. It doesn't mean to say that we can't look at the ambitions of the Feeney report around how we deliver services here and our improvement. And we're actually just going out of session this morning in the strategic planning group trying to ensure that we do that. So that would be my plea around that. And I'm not trying to be trite around that or skip over the issues. There's multiple issues. But you can't really comment on something when there isn't that level of detail, and when it is a very changing and very changeable point of view about what that looks like, and what would that mean for Inverclyde? Because I would imagine that there would be a political view about how we would, if when it moves forward, how would we construct that, and that elected members around this table should be part and parcel, in my view, of that process.
Thanks very much, Kate. As you say, it's a changing policy landscape, and we are responding to that with either support or disagreement. And I think what's clear from the discussion today, there's a real appetite for scrutiny and our responsibility to do so of this and other items in order to get what we all want, which is the best for the people of Inverclyde. So thanks for that discussion and the input, members and officers. Thanks very much. So we just need to note the correspondence today, which we do. Thanks very much. And then that takes us on to item 4, which is the Children and Family Service Specification. And that's back to yourself, Jonathan. Thank you.
Thank you very much, Convener. Again, referring to the report at agenda item number 4, this provides a brief outline of the framework for the intention to redesign children and families, health and social work services within Inverclyde, drawing on our learning, particularly through the impact of the COVID pandemic, as well as some of the policy and legislative developments in recent years. The report itself does provide an indication of the aim of redesign, which is about embracing our ambition for children, young people and families in our communities, as well as I say, recognising changing needs, including the impact of the cost of living crisis and our learning through the response to the COVID-19 pandemic, which really, as members are aware, is some very best practice and the greatest innovation and creativity to respond to a pandemic scale. We do know that there are shifts in our strategic priorities, and Kate has already referred to work ongoing within the partnership about the development of our next strategic plan. And within the redesign for children and family services, we will clearly include, as the report refers to, a programme of ongoing engagement and consultation with staff, with children and families, and with our key partners, both within council services, third and independent sector, to inform the model which we want to build on the principles of relational practice, where we know that relationships are key to reducing harm and improving outcomes for children and families, as well as focusing on the strengths of earlier help and family support to enable children and young people to remain at home. We also want to look at improving the capacity of our dedicated local foster carers and to reduce the need, which is a current financial pressure as well as an outcome pressure on the use of external residential placements for children, and bring more children back to Inverclyde. The report provides an outline of the principles of redesign, and that's drawing on the experience elsewhere and some evidence which does clearly demonstrate that shifting that balance of care towards earlier interventions and intensive supports in partnership with key colleagues in the third and independent sector can have real benefits in improving outcomes for children, young people and families, and it can also reduce the likelihood of children escalating through more formal statutory protective processes. Nationally and locally, we know that the workforce has changed significantly, both in terms of experience and capacity, and local developments such as the supported year for newly qualified social workers and recruitment around targeting master's students within the past year has really assisted us to address some of the recruitment challenges, but we do continue to experience vacancies which impact our frontline provision, and also we know that we want to retain and grow our experienced workforce as well. So by looking at the use of evidence-based interventions to inform our work with families, we would intend to skill up the workforce to support the retention of experienced staff and to grow the newer workforce as well. The report refers to a tiered model of targeted interventions, which really provides an outline to understand how universal services through to intensive supports for families can provide that support from a very young age right the way through to young people moving on towards adulthood and independent living. The redesign itself will clearly be guided by the development of the service specification, which will inform redesign and will be based on our own local data and our analysis of that to understand where our needs are greatest currently and where shifts in demand require us to be able to be flexible in our approach. And we will be taking this forward with our wider workforce starting later next month with the staff development event, and we will then begin a programme of consultation and development with our partners, including council services, to be part of the development of the service specification. We're clearly at the outset of this process, so the report is unable to provide depth and detail at this time, but it's clearly important for members of this panel to be informed of that detail and a detailed timeline as well as key milestones as we go forward. So I'll certainly be happy to bring a more detailed report back in due course, but I hope that's helpful. I'm happy to take any questions, Convener.
Thanks very much, Jonathan. That's great. I'll open up for questions and comments. I see Councillor Armstrong.
Thanks, Convener. Thanks for the report. And we welcome it, and I also welcome the service redesign. I want to make some comments about paragraph 3.11, about the Child Protection Register. I would neither seek nor support move to reduce the number on our Child Protection Register to the national average for the sake of reducing the number to the national average. I think, what sits behind this is forms of abuse. There are some forms of abuse that cut across housing tenure, income groups, and so on. There are others that don't. And I'm not at all surprised that our figure is 2% above the national average. It is far harder to parent well, parent effectively in circumstances of poverty, poor housing, high antisocial behaviour, high levels of criminality, and high levels of drug and alcohol misuse. So I just wanted to, kind of stress that. I don't think that's what that paragraph was meaning, but I think, I think for the scrutiny panel to be clear that being 2% above the Scottish average is not necessarily anything to be alarmed about. We need the children on our Child Protection Register, and subject to a multi-agency child protection plan, those children whose safety requires that, where the risks to each of these children is such that is what's required, and that I think that is where we need to be as a scrutiny panel. Thank you.
Thanks, Councillor Armstrong. Jonathan.
Thank you, Convener. Thank you, Councillor. Absolutely. The fact that our numbers on the Child Protection Register have more recently returned to pre-pandemic levels, I suppose, is a sign of the journey locally and nationally that statutory services have been on during the pandemic in terms of keeping our most vulnerable children and young people safe, but also as the world returns to, I hesitate to say normality, but living with COVID and the legacy of that. The evidence-based approaches that are referred to in paragraph 311 are absolutely in recognition of the importance of our local data, informing where we want to target our development and our redesign. And I suppose thinking about evidence-based programmes that support that earlier intervention with families to reduce the need for those formal statutory processes, but clearly whenever those formal child protection processes are needed, that we move forward with confidence and with absolute clarity in terms of the basis for that. And that's been built into the vision around the redesign.
Thank you. Thanks very much.
Thank you. Thanks, Councillor Armstrong. And Kate coming in as well.
No, it was just a comment. I suppose that the inclusion of the 2%, I just kind of read it as that's where we are at this given point in time. Actually, just to kind of comment about where Inverclyde has been. Now, I was an onlooker, and despite many of the challenges, the Child Protection Register was never significantly high within Inverclyde because of their approach around strengthening families and family support. I think that's the bit that's been lost. and that's the bit that the redesign is going to achieve. So it's about ensuring that families ultimately are the ones that keep children safe and not professionals. So it's shifting our focus on families and communities, because we only work 35 hours per week. So what happens to children out with that and out with education? So the evidence-based models that Jonathan has referred to are very much focused on families.
Thanks very much, Kate. I don't see any other questions or comments in the chamber or on the chat, so just a big thanks for that report. Really good to see it at this early stage, and it was the principles of redesign, and particularly that 3.9, that strengthening family capacity that stuck out for me. Just families who largely all want the best for their young people. We all want the best for them too, and making them supported to be as robust as resilient as they want to be seems really key to it, and that was outlined in your update. Thanks so much. So we just need to know the contents of this report. Thank you. And then we're on to item 5, which is the independent review of adult respite and carers provision. And that is Alan going to take us through this report. Thanks, Alan.
Thank you, Convener. This is a relatively short report, and the purpose of the report is to advise the Social Work and Social Care Committee of the HSEP commissioning an independent review of adult respite provision. This review will also include a consultation on the closure of Inverclyde HSEP's internal respite unit, as well as developing a respite short break strategy for the community of Inverclyde, which would hopefully demonstrate a portfolio of options to support carers, support choice for service users. Consultation will also look at the existing service against practice examples across Scotland. Late 2023, the Chief Officer, as I say, commissioned this review of adult respite care provision. But we strive that we are looking towards developing a robust, modern, high quality, person-led respite care provision, and how that would look for our community. And we're keen to articulate a co-produced version for Inverclyde and develop a high-level delivery action plan. In recommendations was to advise the Social Work and Social Care panel on the commissioning of this independent review. Also, that in 2.2 that we would hope to bring the completed consultation and strategy and present that to yourselves at the Scrutiny panel for the early summer 2024. And 2.3, as been mentioned in a previous paper that's gone to the committee, we would review all service users of respite and ensure that alternative respite option provision is in place in the event of the internal respite unit. I was happy to take any questions.
Okay, thanks very much, Alan. I'm just looking around the room. So I've got Councillor McCluskey, thanks, Vicky. First, thanks, Councillor.
Thanks, Peter. This is really welcome, and thank you for the thorough we discussed it before. We discussed drawing it out and making sure that there is a proper consultation conducted, so this is really welcome. In undertaking this, what consultation is going to be undertaken with possible providers of respite care, especially if we're thinking locally in terms of care home capacity? Are we going to be consulting with potential providers locally as well? Thanks.
Thanks.
Thank you for yourself, Nina. This will be a very kind of broad brush approach, and we would be, as we always do, looking at all kind of key stakeholders and partners, of which commission services are a key part. So we would be looking across providers to see, what provisions potentially, and also what provision could potentially be developed locally. I think it's key that this isn't just about looking what's out there; it's about what can be developed to meet the needs and get a real true sense of not only respite but alternative short breaks and alternative respite provision. So yes, it would involve all key partners and potential providers.
Okay, thanks, Councillor. Thanks, Alan. Okay, I don't think there are no further questions or comments on that, so We just need to know the content of that report.
Great.
Thank you. And then that takes us on to item 6, which is a report and an update on the recent care at home inspection. So Alan's going to take us through this. I'm just going to use my chair's privilege to say a big well done and thanks and congratulations to everyone who was involved at in that inspection. That's just a really sort of, it's a great report to read and shows some of the things that we talk about here, I think, and in our groups about that sort of Inverclyde values of nurture and kindness that we see all around Inverclyde. And I think in this report we really saw that in the pages of the write-up, and so it was great to see it. But I'll hand over to you, Alan, to tell us a bit more about it. Thanks.
Thank you, Kavina. Yeah, thank you for those really positive words. And I think it's fair to say all the team are really chuffed about this report. And it really, you can never really demonstrate all the hard work that goes into these things, but I think this gives a flavour. So thank you. This report's to write an update on the recent care at home inspection carried out by the Care Inspectorate. This was an unannounced inspection on the 6th of November, which was carried out over 6 days, which finally completed on the 15th of November. So it was a very, very robust inspection, and it was also a time in a very challenging time for the service. And you'll know that there has been a lot of previous discussion around the services that developed here. The inspectors covered a range of shifts. It's a service that covers throughout the day, and also included early morning lunch calls and our very dedicated night shift workers. Feedback was taken from service users and staff, which was overwhelmingly positive. And again, that was despite the known recruitment challenges that have been discussed before. If I could take the panel to item section 1.4, this demonstrates the areas where the service was inspected. People experienced compassion, dignity and respect, which they were graded 5, very good. People get the most out of life, again a 5, very good. People's health and well-being benefits from their care and support, again 5, very good. And in terms of our own leadership, quality assurance and improvement is led well, again 5, very good. I think it's fair to say that if you looked across nationally, this is a really quite a high scoring report if you compare with other areas. That's not to take away from the hard work that happens in other areas, but for us locally, I think this is a report that we can be proud of. As with all reports, there's always learning. There's learning around the way that we deal with medication, but that's not in any way unusual. So it's a changing piece of work. So we recognise in the service that's something we'll work with colleagues across our pharmacy to help support our colleagues in care and support at home. I'm happy to take any questions on the report.
Thanks very much, Alan. Okay. I don't think there are, apart from Councillor Jackson. Thanks very much, Councillor.
It's just a question as well as cover over staff within the organisation. So it wasn't pretty nice.
That's something I can get back on, Chair, for any services. It's actually one of our biggest services. There's over 500 colleagues that work in it. So we do have a regular turnover of staff. I can get back to you with the exact figures on that, Councillor Jackson.
Yeah, it's just given in regard to the point that medication is an issue that's been this local government for a year. I just could suggest that the staff can explain that. That's just the observation.
I would perhaps just get back on those figures, but also can also perhaps give some examples of where we're supporting all our colleagues in terms of where their services are developing and where there are challenges that we make sure our colleagues are fully supported. And that's where our colleagues in pharmacy have been excellent in terms of supporting the staff. But I could get back to you on that if that's okay. Thank you.
Thanks very much, Alan. Councillor Reynolds.
Hi. Just a comment on the areas for improvement. I worked as a care home pharmacist for NHS Ayrshire and Iron for a couple of years, and ended up doing nearly 500 medication reviews across North Ayrshire. Whether residents in care homes. I know this is not care homes, but whether they were on 1 or 20 odds, there was always something you could change. And it's difficult to do that for home people. And also are they resourced for that? I know how busy it is in trying to keep on top of medication reviews that are needed within GP practices. It's hard enough without having home visits on top of that. It'd be interesting to know what your discussions are to try and make a dent in that or improve that.
Thanks, Councillor Reynolds. Thanks, Alan.
No, thank you for that question. Yeah, as you know, it's a very complex area of support for all colleagues that are involved in it, and prescribing is always evolving, and in terms of our pharmacy colleagues, we work very closely with them, both within the local community pharmacies and also within our own pharmacy support team, and we've got the primary care improvement fund pharmacists as well. It's as I say, what we are doing, we put the resources that we can into supporting colleagues in terms of medication changes and in terms of the use of medication. It's something that we're constantly looking at and seeing ways that we develop, but it's something, as you know, potentially in the future, as position changes, that we may need to look at other resources to support that piece of work.
Can I come back in just for 1 minute? I was recently on Pharmacy Champion still for community pharmacies in Inverclyde, and I recently got contacted by a couple about the marshes going out, and there's a bit of discussion around that at the moment. So if there's any discussion, it'd be quite useful for me to know about that.
Thanks, Councillor Reynolds. Kate, you're looking to come back
I
in.
just would want to add a little bit that we actually we have a centre point contact for our home support workers through pharmacy. Okay, so part and parcel of is because of the medication and the times that home support workers might not actually know about the medication, that they're actually trying to encourage people and support people, that they have that central point of contact. But it's right, it's a constant ongoing updated training agenda for our home support staff. It is our home support staff that delivers it. Pharmacy supports that process, but in the main it's our home support, and it's always a training. I think the fact is, if they were saying that our medication policy, or there was something wrong with it, I'd be worried, but the fact is that it's just about fine tuning some of how we record that. I think that that's something that we would take forward, and we'd probably do a sample around that and that improvement.
Thanks very much. Kate, Councillor Brooke.
It's a point of information before we go to private session. It's not relevant to item 6.
Oh, right, okay.
So items included with your permission.
Make that point. Yeah, thanks.
Just, I'm aware to you that papers have been presented in a different format in this time, and I just wonder if it's pressures on democratic services or it's a change of how we're going to do papers in the future. Just different way of presenting. It's just for my knowledge, it's different.
Right, thanks, Councillor Brooks. Can I make a final point in relation to this report then, and then we'll see if that can be addressed at this point. Sorry, I got mixed up with the order there that we were going in, so I think there's no further questions and comments on this item. So I think, I'm sure as the scrutiny panel would just also like to pass on our thanks and our recognition and congratulations to all the staff and the leadership as well, who were recognised, and it's just great to see that real standard of care that we strive for in Inverclyde recognised here. Thanks so much for pointing different parts of it out to us, Alan. So we know the contents of this report. Thank you. And I wonder if anybody, just before we move into private business, I wonder if anybody is able to respond to Councillor Brooks' point at this stage, or if we want to look at it and get back to Councillor Brooks in terms of the. Is it possible to give a little bit more detail about the different
printer? Page numbers aren't on the agenda. It's just if we've had it presented differently, I'm not saying there's a problem. It's just, is this the new way, or is it challenges with democratic services? I don't know. Just why we look differently, it will in the future.
Right, thanks, Councillor Brooks. Kate.
There's no challenge with democratic services, there's been challenges with the HSCP. This correlates, we've had the agenda items correlates with the IGB as well, so it was pre-Christmas and we've had to manage two significant agenda our meetings that are very close to each other, so our apologies.
No,
We will
absolutely
get
acceptable,
it.
absolutely
Okay.
Thanks very much, Kate, and thanks, Fredericks, for that point. I'm sure. Thank you. So, yeah,